As of today, 35 cases of Ebola have been confirmed in the country, while 8 deaths have been recorded following the outbreak of Ebola in Uganda 12 days ago. These cases have been identified in only 4 districts of Mubende, Chegegwa, Kasanda and Kagadi. In order to combat this outbreak, officials from the Health Ministry have today met different players within the health sector to mobilize funds to address the outbreak. According to Health Minister Dr Jane Ruth Aceng, around 65 billion shillings is initially needed to roll out the country's Ebola response plan.
This money is quite little. It is not enough to completely bring the Ebola epidemic to an end. However, it is enough to move us as we assess the evolution of the pandemic, of the epidemic.
This includes disease surveillance, laboratory services, as well as the provision of resources to medical workers involved in the fight against Ebola. The money once raised will be mostly used in the 4 affected districts over the next 3 months to combat the outbreak. Dr. Aceng also points out that protecting health workers against contracting Ebola is top of the ministry's agenda in its response plan.
We need our health workers. We value them. Without the health workers, we could never have controlled COVID-19. Neither will we be able to control Ebola without the health workers. So we all must work towards protecting our health workers and encouraging them.
Additionally, the ministry will carry out community engagements within the most affected districts as well as 20 neighboring ones to sensitize the public about Ebola.
It is extremely important for them to understand, and for all of you, that the earlier you are detected, because Ebola comes with an acute fever. You get an acute fever now, sudden onset of fever. You just take yourself and you're tested. Once you're tested and confirmed positive and we start supportive care, your chances of survival are very high.
However, Minister Aceng has reiterated that government will not be imposing limitations on movement and public gatherings, as had earlier on been feared.
We are not restricting movements, we are not closing schools, we are not closing places of worship. People are free to move on and about with their business.
Joyce Nakato, NTV Weekend Edition.